first part. It sounds like maybe you were welcoming me in.
I was welcoming you.
Hello, my audio wasn't coming through at first, but then it sounded like it was towards me. So hello, thank you for having me.
Yeah, thank you for joining us. We have some other business to transact, and then we can hear from you. Well, okay, it is exactly 6 p.m. by the clock on my computer, so I will call to order our first public hearing of the night. The Dunn County Health and Human Services Board will hold a public hearing at 6 p.m. regarding the county's community development block grant. Chris, I assume this was duly noticed?
It was.
Krista, do we have any comment from the public on this hearing?
No public comment.
All right. Any questions from the board? If not, I will adjourn.
I think that in order to satisfy the requirements of what we say we will do, so we're actually doing two things. But so this first one is the second public hearing for our first coronavirus, Cdbg coronavirus grant. And part of that is part of the responsibility that I have in that is just to give you an update of that, a review of what's happened thus far in that program. So I will give you a quick review through, I filed a report with the Department of Administration in mid-October for the first half of a year of activities, starting in April and ending at the end of September. And so at that time, and this hasn't changed, the number of people we've served has changed, but we have, with the money, with the original Cdbg money, we have developed 2 transition houses, one for men, one for women. Women's house has 6 beds, the men's house has 5 beds. We have 1 full-time case manager from West Cap who works with those homes, and we have 1 in the hire that is in the process of being hired. We have a half-time housing assistant with stepping stones, an emergency housing money through stepping stones for hotel stays. And between April 1st and September 30th of this year, we served 40 people through stepping stones. And then some of those people moved on then to those transition houses, transition spaces at West Cap. So there's a kind of a duplicate. So we're counting sort of who comes through the door, because some of them will be served then in both of those programs. So that is what is happening in that particular area. Any questions about that?
Thank you for correcting me. Any questions for Chris on this Cdbg CV grant? In the absence of questions or comments, I will adjourn this public hearing and convene a second public hearing regarding the county's proposed application for Community Development Block Grant Planning, Cdbg PLNG. Krista, do we have any public comment here?
No, we do not.
All right, Chris?
Okay, so included in your meeting packets for board member was a written piece of information for the purposes of those who may be tuning in via the public feed. I'll just briefly address the things that are related or agended as items related to the Cdbg planning grant. So Dunn County, the City of Menominee, and the Village of Boyceville have agreed to collaborate on doing a housing study. The Dunn County piece will be county-wide, and there will be deeper dives into information specific to the City of Menominee and the Village of Boyceville. In order to fund that, the West Central Community Regional Planning has agreed to submit on our behalf for a community development planning grant. And that would cover 2/3 of the cost of a study up to $50,000. So CDBG is a federally funded grant program that comes out of the Housing and Urban Development on a federal level, comes to the State Department of Wisconsin Department of Administration for administering of those monies. There are several different kinds of grants that are available. There are planning grants, which require a 1 to 3. So the planning grant covers 2/3 of the cost, and you need a 1/3 match. That's the piece that we have. There's a public facilities program, which assists government entities in building public infrastructure and facility improvements. There is an economic development grant, which helps to assist businesses to create and retain jobs for low and moderate income individuals. Public facilities economic development, which is awarded to local governments for public infrastructure projects that support business expansion and retention. And then there is a CLOSE grant, it's called, designed to provide necessary regulatory and financial flexibility for communities to address local housing while addressing concerns related to the CDBG Economic Development Revolving Loan Funds. So there's more information in the packet. There's more information on our meeting notice on the Dunn County website that goes into those areas of potential grant funding more in a little bit more depth if people are interested in finding them there. So the identified project for the planning grant would be to partner with the City of Menominee and the Village of Boyceville. The management grant amount is $50,000. It's anticipated that our cost would be about $26,000, meaning that the grant would cover 2/3 of that cost, and it would leave less than, I believe it leaves $8,800 to be split between or to be divvied up between the 3 entities that are participating. And the activities will include individual community studies for the participating communities, and then a county-wide study. It will look at housing supply, housing demand, housing gaps, as well as make recommendations, develop a community housing toolkit, and a housing action plan. And there will be community public housing forums for the various participating communities where the public will be invited to offer their input into the process. We do have to say that because there are specific requirements out of HUD, there will be no displacement of persons or homes in this project. And then were there to be any public feedback, we would accept that at this time. But I would also say that we're open to public feedback at any point in time about these projects, and they are able to be submitted to the Department of Human Services at any point in the process.
Absolutely. And we have no public comment at this point. Any questions from board members at this point? If not, without objection, I will adjourn this public hearing and call to order the regular December 16th meeting of the Health and Human Services Board. Let the record show that all of our present members are here, and including Chairman Bartlett. I'm sure that you all join me in acknowledging the sudden and very sad passing of our colleague Sarah Kennedy yesterday. We will certainly miss her on this group. Mr. Miller today posted notice that there will be a memorial service for Sarah next, the 23rd. What day is that? Thursday. next Thursday, the 23rd at 11 a.m. at Grace Episcopal Church. And as a committee, we will consider offering a gift to the neighbors of Dunn County as requested. I will need approval of our minutes from November 18th, 2021.
Diane, this is Greg. I sorry to bring this up, but would it be appropriate to do a short moment of silence in her honor before we start? Just to throw that out there.
Greg, that's extremely thoughtful. Thank you. Thank you so much. Let's do that. Thank you all. Thank you all. Meeting minutes from November 18th. I need a motion to approve. Ms. Barker?
Motion.
Ms. Barker moves. Is there a second? Supervisor Cromrie seconds. Any additions or corrections to the minutes from November 18th? If not, all in favor of approving, please say aye.
Aye.
Any nays? All right, the minutes from November 18th are approved. Next up, public comment. Krista, do we have any public comment?
No, we do not.
All right, no public comment. All right, our next meeting date will be, sorry about that. Our next meeting date will be January 27th. Let's move on to our regular agenda, beginning with a report from Veteran Services. Greg, you're on.
All right. Good evening, everyone. I'll start off with the narrative report, just kind of hit some of the highlights that you guys had received. Underneath the local efforts, you can see that, again, outreach and collaboration is certainly an important part of what we do. There's a home care agency that I met with to just kind of identifying some of their services, and it's been a little limited with the availability of some home care services. So this will be a welcome addition within the community, and so it's helpful for us with a lot of the veterans that are in need of these services, because that collaboration, we can sometimes get updates on what's happening that we may not otherwise be aware of, that we can do some additional services for them. The other thing, I only handed out one newspaper article. Chairman Morehouse, I put it in your mailbox, and I want to thank Mr. Steen for kind of coordinating and highlighting the fact and getting us to work with the local newspaper. And I can't say enough good things about the effort that was put in by the writer. I just had to answer a few questions. She did an incredible job researching everything that was public information, with that was on the county's website and stuff. So I thought it was did a great job kind of capturing good things that are happening, especially in light of everything kind of going on in the environment. It's nice to hear some good positive things at times. So Gary, thank you for coordinating that. You kind of made life easy for me.
My pleasure, Greg. I bragged you up.
All right. So the next item, state benefits. I had nothing significant to report listed on there, but I'll just since this report went out, we got notification of we submitted an annual application for a County Veteran Service Officer grant. There's be a slight increase based upon the state's budget. So we typically are eligible for 10,000, but now we'll be eligible for 11,000. in a small office, small budget, every little bit helps. So that'll be submitted a little bit after our next meeting, but I think it's noteworthy. On the federal benefits, in the Veterans Administration world of presumptive diseases and exposures that a lot of service members encounter, lots of diseases are as a result of those exposures. As we see things kind of trending from so much emphasis on the Vietnam War and the exposures from that time, and even prior to that, it was our Korean War veterans with the honestly, for them, it was the environmental exposures with a lot of cold weather injuries because of inadequate gear and the terrain. We're now seeing the emphasis, a lot of focus on the research to support from a lot of the poisoning of our current veterans from the first Gulf War, with a lot of the medications and vaccinations that to prepare them to head over. There's a lot of research results, and then of course burn pits is a common thing that we hear about in the news with a lot of the plastics and airborne. So I just listed in my report a few of the diseases that they've identified as presumptive, just meaning if you were there, it's presumed that you were exposed, and some of the stuff falls underneath undiagnosed illness. A lot of individuals fall into a category where they don't feel healthy. They have all kinds of symptoms, but the doctors can't find the etiology of it. And however, in the world of insurance, docs can't get paid unless they put a diagnosis on something. So sometimes that hurts what we're trying to do because they want to get paid. So they'll put the closest diagnosis on it, which then in turn will hurt with what we're trying to do. But it's just a world we have to work within and navigate the best possible way that we can. So that's just more information. I think as we continue to work together, there'll be more that will be added to this list. And I can say, with just emphasis on kind of the different areas that administration targets. Last administration made a lot of nice improvements within how the Veterans Health Administration served veterans in the rural community, allowing them to have easier access to the hospitals. The current administration, there's a lot more emphasis on some of these exposures as a result, and Mr. Biden has said that because he believes his son Bo, who had died from brain tumor, that was a result of the exposures that he had. So, those are the trends that we look at in our office to kind of see where the administration's emphasis are, so that we can best get on board to make sure that we're acting quickly to help individuals. So that's a benefit to our newer veterans with the current administration, and they're doing some more research and actively speaking. And even the Veterans Administration, or the Secretary of the VA, is talking openly a lot about some of these current challenges for the newer veterans. So financially, at this point and nearing the end of our fiscal year, I don't see any challenges to meeting the expectations of our budget within what has been approved. So we shouldn't have any challenges there. Looking forward into fiscal year 2022, we're doing a test on a new veterans management system, client management system, data management, whatever title you want to call it, but it helps us do our job more efficiently. And so we're beginning to test next week. And the nice thing is there's no cost for any migration, because that's part of their marketing to draw people in. Of course, I'm sure there'll be a consideration for increased costs in the future, but to get service offices to test their product, they're offering up that no cost migration. But it is the only program that it has the newer technology for seamless and protected transfer of data. So we're going to give that a good run over the next 90 days to see if that would be a product that would be able to fit with what we do and capture everything that we need. But the cost is less than what we're paying for the current system. So we're going to give that a good thorough review.
Greg, what is the approximate cost at this point?
For this, it's just based on user license. I think the cost is like $475 per user. We only have 2 users in our office. Our current program, we pay about $1,400 on annually on it. And those that estimate, I'm sure give me a little like $10 leeway one way or another on
You
that.
got
But
it.
little bit of savings will be in that. So with no changes in any reporting regarding our emergency preparedness, we're still functioning fully staffed. Still have our volunteers in the office. Any questions regarding that report based upon our local, state, federal activities?
Any questions for Greg?
All
I
right,
guess not.
I'll move into workload report. And again, I include in your packet current fiscal year 2021 up through November, and then to be able to compare with fiscal year 2020, just so you can kind of see activities related to records that we work on, forms, and all this is kind of coupled in with phone calls, walk-ins, answering a wide variety of questions. So we want you just kind of have a snapshot to be able to see the activities and the effort that's going on. Included is 2 impact statements. It's important to identify what and how we're impacting our local population of veterans. So the first impact statement, to give a little brief description, when a veteran has a service-connected disability, in this case, it was an orthopedic condition. It injured his back while on active duty. Actually, it was in a car accident that impacted his lumbar spine, and he had a surgery to do some repairs on it. Surgery hasn't been going as well. The fusion hasn't, the bone development hasn't been as fast as they hope. And so he's been off of work over a year, and they won't release him to work. But typically the VA will do a generalized 100% disability for somebody if they have convalescent time, just kind of a normal figure calculated in. However, in this instance, we've had to fight because he has not been released to go back to work, and we've had to do an appeal to get the VA to agree with us that they should continue to pay him a little bit longer until that fusion takes, bone development's there, and he's returned to work because he doesn't have his livelihood. And they agreed with us up to the last date, that he had an evaluation. So that for him, it was pretty important going into the holiday season, because he's exhausted a lot of his resources and stuff, and pretty tough when you're used to providing for your family and you've got some conditions that are not allowing you to do that. So we're doing other work to see about getting him retrained potentially and stuff. So there'll probably be some stuff in the future to follow. The next impact statement, I've already reported on this veteran, a lengthy appeal dating back to 2015 for this individual that served in Thailand, that we were able to show and support that he was exposed to the defoliant called Agent Orange. There's been a deferred condition. Secondary is diabetes is one of the probably the more common diagnosis from that herbicide exposure, Agent Orange. And so they've finally went ahead and approved his renal disease, because he's on dialysis now 3 days a week. to keep them alive. And so they approved that, which resulted in another significant amount of retroactive pay. But total combined this year, this gentleman has received $187,000 due to him. Now they consider him 100% disabled. If you're on dialysis, they're good about granting that, and that's just now part of his normal what we call battle rhythm or schedule, 3 days a week going through this. But he's doing well, and this is somewhat of a bit of a consolation for the impact that this has had on his life. So that just kind of closing that one out. Now it's just nothing more than claims maintenance for this individual to go forward. Any questions regarding workload report impact statement? The last item then is you have our budget usage or the revenues, and then expenditures this is a report taken right directly from our accounting software. And again, I don't have anything significant within this to report. We will meet our budget as approved by the county. So pending any questions, that'll conclude my report.
Any questions for Greg on any parts of his always very helpful report?
And Merry Christmas.
Thank you.
I'll end it on that. Merry Christmas.
Thank you, Greg. Thank you for that
Yeah.
very good report, and Merry Christmas back to you. All right, moving on. The Department of Public Health.
Good
Katie
evening.
Gallagher is here.
So,
Welcome.
thank you. I will get us started just really quickly and then pass it over to our public health nutrition manager, Grace Poliak, to give you guys an update about our WIC program. But first, in the documents that I sent you guys as handouts for today, earlier today, there was a draft document that I wanted to bring to your attention and just understand a little bit about where your perspectives are as the board around something that is done by the health department. So the Western region is exploring where we need to be as we move towards a recovery mindset with our COVID response and contact tracing, specifically looking at what we're doing now and how it may relate to other Category 1 communicable disease follow-up, as well as Category 2 communicable disease follow-up like influenza, and how we significantly decrease mortality and morbidity while maintaining public health workforce and public health programming. We're going on 2 years where normal public health programming really has not been able to exist. It has been all contact tracing, all COVID mitigation, really at all costs. And so the region is talking through how can we still do what we need to do statutorily, but do it in a way that maximizes our resources. And so what I put in front of you guys today is the conversation and the recommendation from the region to prioritize disease investigation over regular contact tracing. So meaning we touch as many of the disease investigations or the folks that have tested positive as possible, prioritizing the folks that are highest risk for adverse health outcomes based on underlying health issues, based on age, based on access to a medical home. And that we really give ourselves permission to only prioritize contact tracing within households versus contact tracing more broadly within a workplace setting or within an educational setting. That would not extend if we had an outbreak. We would be more intentional about contact tracing within an outbreak setting so that we can get our arms wrapped around it. But the real challenge that we're existing with is that we have a lot of turnover in our contact tracers. It is a hard job. And we're not as successful as we were a year ago, really, as folks are making informed decisions with home tests. We don't know about them, and choosing not to answer the phone when we make the call. So there's not that necessarily the opportunity to do the contact tracing. And so that's really to tee up where the Western region is moving and tee up where Dunn County Health Department, I believe, is moving. I want to hear your perspectives on that.
And so that would, the Western region is recommending essentially option C on the document that KT sent to us this afternoon. Yes, please. I want to hear some comments on this. What board members thinking? Dr. Hall.
Hi. So I want to make sure I understand because I don't always. And so, and I totally understand the rationale behind needing to think about doing things differently. So right now, for example, if someone that I've been, not that I go out to lunch, but if I'd been out to lunch with someone, or if I had, been at work with someone or something who tested positive and then identified me as a close contact in that conversation with the health department, but is that still happening where they give a list of their close contacts and the health department tries to contact all those close contacts and say you have been exposed, right? That's
so typically we do have that conversation, but if we are not able to get to all of our disease investigations and they say, Dr. Hall, you say, I've talked to them, they're all fully aware, I've done my own contact tracing. We document that you shared that you did your contact tracing, and we don't ask you for a line list or a list of your friends and their phone numbers. In situations where there is reluctance to share that information, then we would do additional contact tracing as time allows. But right now, time, especially since Thanksgiving, time has not allowed.
Okay. So right now, essentially what's happening is that people are contacting their own contacts, right? And
Hopefully.
Well, right, ostensibly. Okay. And so that was one thing that I just wanted to clarify. And so under option C, so would you, I'm having trouble understanding what is different from kind of what's kind of de facto happening maybe now.
I think that's a really good point. I think much of it is de facto what is happening right now. I think it's putting words to it and it's building some consistency within the region. Honestly, I think Dunn County has been doing more contact tracing than many of the adjacent counties for longer. And that does put us at a disadvantage when, we have those conversations with folks that have kids in different counties. Why are my kids that are at this childcare able to go back, but my kids at this school district are not? It's because we don't know about them, or the other county doesn't know about them. And so that is challenging. I think so. Getting some regional consistency is really helpful, but then also getting some regional perspective on what constitutes high risk and how can we then take our time and maximize outreach for boosters, outreach for education, outreach for testing, instead of all contact tracing all the time.
As a school district, every district is dealing with it differently. Boyceville, we are contact tracing, and it takes a long time because either our nurse, I contact parents, the other administrators contact parents. We are following the 8-10-14 model. And it gets to be long, cumbersome trying to explain it to parents. It came up at the board meeting last night. And the concern was that, if the county does this, what does that do with the school? We would, and I honestly do not know what Menominee does. I know that they send out letters. Your child is a close contact, right? Is that what we are going to be moving to? The only ones that we would insist stay home would be those family members. You know, if there was a positive in a family, then the family members would stay home. Not the close contacts unless they have symptoms. So if they're asymptomatic, they can come to school. There was definite concern at the board level for that, because we've done a fairly good job mitigating it within our schools. I think we have more this year than we did last year. Once again, it's a different environment. We're not masks, it's not mandatory. You know, a lot of the places are not 6 feet apart. We are 3 feet if we're lucky. But what we're seeing is it's families that it's spreading in, and they bring it into the school. So I'm just telling you, this is the conversation we had last night at our school board meeting.
Dr. Hall, did you have another question?
Yes, thank you. So the other thing, of course, that I think brings some urgency to this is, of course, the Omicron variant and the explosive case growth that's happening. So I used to work at Cornell University, and I have colleagues who are there still. And for most of the semester, they would diagnose 3 to 10 cases a day, maybe, out of their 27,000 students who they test every single week, even though 97% of them are vaccinated. Oh. And in the past 4 days, they've diagnosed 1,000 cases. You know, and so they've just shut down the campus. And so that's coming. It's not really here yet. It looks like it's just starting to hit at Harvard and at Princeton and at NYU. So I think this conversation about what is really feasible and what is really effective is important. I think from a public standpoint, I can see that certain people would be huzzah for any less involvement of the health department with this particular diagnosis. But I can also see some people who might be like, you mean I could be a close contact and not know it? And so I don't know how we would think about kind of addressing that concern. And maybe the answer is, well, that might be happening now already, and you just don't know that you don't know it, and it's just not feasible given the scope of what we're seeing and what we're dealing with right now, and certainly with what we're likely to deal with in the relatively near future.
Supervisor Cromery, please.
Hi, Katie. So do you feel that your team has capacity to handle that option? Or, I mean, I'm just reading it briefly over since the meeting started, so I didn't get to delve into it too much, but it looks like quite a lot of responsibility. And I don't know if it really, you know, takes anything off your plate. It looks very time consuming. And I just wondered if you had the capacity on your team to handle something like this.
So it's like Dr. Hall pointed out, it's very much in line with what we're currently doing, other than a prioritization scheme quite so much. And so what this would allow for is for folks that are, you know, fully vaccinated, not connected to an outbreak, not connected to small children, that we could explore an electronic way to receive some of that information. And so that would give us a little bit of time, because we are currently calling those folks. And if we don't get to them within the first 24 hours as statutorily required for category 1, we're going back the next day or the day, day after that, until we can make that phone call. And so with the ability to use some electronic data gathering and prioritization, I think that would give us more time back, Supervisor Cromery.
Okay, good.
Yes, Dr. Hall.
Another question. So for the Western region, so my question is, does this include the other counties in like the Chippewa Valley? Does this include Chippewa and Eau Claire as well? Okay.
Yes, it goes, it's basically the footprint for the HERC region. So up to Douglas County, down to Pepin, over to Eau Claire.
Other questions or comments for KT? Ms. Barker, did I see you with your hand up? Oh. I told KT this morning that I'm pleased to see this kind of region-wide prioritization, because there are, the demands on our staff have been incredible, and this is so difficult, and the other public health priorities, and believe it or not, there are other public health priorities that just simply are not being addressed. So this is, it seems to me that this is a step in the right direction. How we function, I guess, with the Omicron situation is perhaps another matter, but for now, this seems like an appropriate and sensible move.
Thank you for that feedback.
Anything else? Other feedback for KT? All right, go ahead, please.
So I just wanted to turn it over to Grace. Grace has been our public health nutrition manager for not quite a year, and we're grateful to have her. And she will hopefully share with you guys a little bit about a program that has been existing while remote, fully separate from our COVID response with our WIC program. Thank you, Grace.
Grace Poliak, welcome to Health and Human Services Board. We're glad to have you.
Thank you. I did make a few slide PowerPoint just to share some graphics with you today. I'm going to pull that up, and hopefully it's sharing, because it doesn't say so on
Looks
my
fine.
end. Okay, so like KT said, my name is Grace. I've been in this position since March of this year, and I just thought it would be a good idea to introduce myself, to give a WIC update this year, and let you know where we're hoping to go. So we're currently serving 360 families in Dunn County, which is 588 participants. We also offer 2 additional programs for our WIC participants. We have a Fit Families program and Breastfeeding Peer Counselor program, which are grant funded. These are newer programs, started in January of 2020 for the Fit Families program, and the Breastfeeding Peer Counselor program just kind of got off its feet at the beginning of this year. I feel like they've been a really great way to connect with participants during the last year and a half, have that extra support and connection on top of their WIC appointments. So those that do participate in the programs seem to like that extra connection. And then I also wanted to share that the fruit and vegetable dollar increase has been extended through March of 2022. Some of you might remember that this had been increased in the summer months to $35 per participant. The original amounts are $9 for children and $11 for pregnant or postpartum moms. So these new amounts here are a really nice increase. Started to go through December, and they just extended through March. So some of the key words we hear from our participants when we're letting them know of the extension is that they're relieved, happy, excited, and thankful. A lot of participants have reported that their fruit and vegetable consumption is higher now that the increase has been extended, because they're not as worried about the extra dollars that they'll need to spend on their groceries. So that $9 and $11 can be helpful, but can still be weary to buy groceries when you know you might go over that amount. So I'm happy to say that over half of our WIC families use the fruit and vegetable benefit. About 28% are using over half of the benefit. About 15% use over 3/4, and about 8% use over 90% of the benefit. So one of the big things that we're always consistently working on is educating participants on the best way to use their benefit to stretch that benefit dollar as well as their grocery dollar. And then of course, just the importance of promoting fruit and vegetable consumption in their household. And then the Farmers Market Nutrition Program had a really great response this year, so I'm happy to share about this. This year, we were able to issue $30 worth of checks per participant rather than previous years. It was $30 worth of checks per family. So we had a larger amount of checks going out. Over the last few years, there's been a pretty steady decrease in the check redemption rate for Dunn County as well as statewide. And this year we saw a 9% increase in Dunn County. With the check increase and the increase in redemption rate, that gave us a $4,710 total for local farmers in Dunn County. So that equaled out to just under $2,000 of an increase from last year for our local farmers. So not only a big win for our families who participate, having that extra produce in the house, but also for our local farmers. So I'm hopeful that we have that increase again next year and the state decides that it was a good move to do. Earlier this year, I think KT may have shared that we did some nutrition education lessons at the market for our participants, trying to encourage them to come out and use their checks. We also did a farmers refresher training. I went to the market with our interpreter, Zua, and was just available to answer questions and try to get them more confident in accepting checks. And in doing so, we also signed up a few new farmers for this year. So participants were happy to see that there were more booths that took the WIC checks. Makes it a lot easier to use them when everyone's accepting them. So we also did a farmers market scavenger hunt bingo for kids that were in our Fit Families program, or if children from WIC were at the market and stopped by, or any children walking by that wanted to know what it was. So that was a fun little addition as well. So looking into next year, one thing I am looking forward to doing is strengthening our community partnerships. I think that there's a lot of opportunity in Dunn County to collaborate with different areas for WIC and Fit Families and just get the name of WIC back out there. Another thing we're working on that I'm very excited about is increasing our social media presence. I brought the idea of a WIC-related TikTok account up to the state creative marketing team and named it WIC Talk and had a really positive response from that. So I'm working with the creative marketing team on getting something set up where all of the counties across the state could use content and submit their own content and get the word out there to a different population, a younger generation of possible WIC eligible participants, and just trying to end any stigma surrounded by the name of WIC. And then lastly, one of our goals is to return to in-person appointments. Right now, the presence or the waiver for physical presence goes through April of 2022. So we will return to in-person appointments at that time or when the state finds it safe to do so. With the population we're working with, it's definitely a bigger concern jumping into it too soon. So in the meantime, all appointments are by phone. We do have a lot of participants that have reported that they like phone appointments because of the flexibility and the ease of not having to worry about transportation or loading up their infants and children in the snow. So we've found some ways to make the in-person appointments work. And we are just working on a plan to get back to in-person appointments as soon as we're able and make a smooth transition for not only our participants, but for us as well. So that's the update I have for WIC. If anyone has any questions, happy to answer or send me an email. And yeah, thank you for having me.
I got a
Yeah,
question.
thank you for that. Yeah, please, Supervisor Bjork, go ahead.
Nice report, Grace. Good job. I'd like to go back to the fruits and vegetables that are available for WIC participants. And every fruits and vegetable project starts with a tiny little pack of seeds and some warm weather or a warm place to start plants. Is there anything available that I would call, like a portable hot houses where where people would start plants? The earlier you can get something to a farmer's market, the better you do. It would seem to me if we could help the growers get their plants up and going sooner, that would make a longer time, have fruits and vegetables available, locally. And then the other thing that I'm always looking at is youth involvement. And I know the FFA programs, the eggs at the high schools, a lot of them have their hot houses, and there are students that learn to grow vegetables and what they need to do for germination and transplants and lots of things to learn. But, there's a real untapped source of growers and 4-H members that would have a horticulture project. And wouldn't that be a neat thing that there was a way that a 4-H member, a 15-year-old or 12-year-old or any age could get started growing fruits and vegetables and have them marketed at a farmer's market of some sort or along the road and be part of this WIC thing. So that we're not just talking about fruits and vegetables getting in people's refrigerators and into their diets, but also can we help people to have more growers, I guess is what I'm saying. There isn't any program, is there, that would help people get started growing fruits and vegetables?
That's a really great point. I think that there's not a specific program right now, but that's part of where strengthening all those community partnerships. I think that there is a opportunity for something like that, maybe not at as large of a level to happen right away, but to reach out to the local 4-H community and see if there's maybe an activity we can work with them, maybe for our Fit Families program or something with WIC to start teaching kids where it comes from and where it all gets started. And then maybe it will snowball into something bigger. And I think that would be amazing to have that happen. So thank you for bringing that up. I'm happy I added that in there and that you asked that.
Well, you look like a person that could ask the right people the right questions. And think how exciting it would be to just have like 5 new growers that, that their end game is that we're gonna start this horticulture project, and our goal is to have fruits and vegetables available and then being able to be purchased by WIC people. So I think it's, they do it in livestock, right? We make a big deal about selecting that calf and raising it up, and we take it to the fair and we sell it. And so anyway.
Yeah, thank you both.
Thank you
both.
One more thing to add with that is a great thing about the farmers market program is any farmer in Wisconsin can accept WIC checks. You just have to go through the training for it. So possibly by reaching out to the 4-H community, there might be a lot of farmers that didn't realize that they can do that. So I'll certainly bring that up to them as well.
Excellent. Any other questions for Grace? This has been a very helpful presentation. Thank you so much. Other questions or comments? Thank you for being here. Thank you for facilitating that, KT. Thanks, Grace. Finances. Who, KT or Sarah or both?
So you did have finances sent to you
In your packet.
In the packet. What I do want to share with you is that there, at this moment in time, because of the change in the work that we're doing and the funding for COVID, that there does appear that we will be returning a fair amount of levy this year. And it has not been settled. We're still definitely waiting for more expenses and more CARS payments to come in. But I did want to share that with you. Sarah, is there anything else we should add?
I think that's a great lead. We just don't know what we don't know. We don't know what's coming up. And this is our best guess estimate right now.
Okay. Supervisor Steen, any questions on finances? I don't want to skip
Yeah.
you.
Sarah, give us the ballpark figure on the health department's return.
Right now, it's projected $198,180.89.
On this blue page.
Thank you very much.
You're welcome.
Thank you both. Anything else? All right, thanks to the Health Department for an excellent report. Carry on. Department of Human Services, Chris.
All right. I'm going to spend my time today just reviewing and then kind of looking for not a formal action, but I guess if there's a strong caution or thought that this is a direction we shouldn't go, to hear that, give you opportunity because it's a large dollar amount. So you're well aware we applied for the first round of Cdbg COVID money. We did the second public hearing for that money tonight. There was a requirement for 2 public hearings, one in the planning stage and one after implementation of the project. That funding source runs through the end of 2022. In about 2 months ago, the Department of Administration released round 2 of COVID Cdbg COVID monies. And but they asked that anyone who was interested in applying for those monies contact them first before submitting an application. It's a first come, first serve application. And so I made, I had been asking them prior to that at the Department of Administration if there was extra money from round 1, because we would take it. And then so when I contacted them about round 2 and set up a meeting with their staff person, they said, yep, we know that you want some more money. So we've been thinking about how to do this expediently for you, you and others who are interested in additional funds. And so rather than you having to submit a whole new application, you can use all of the foundational work that you've done up to this point for your round 1, and you can simply send us how much money you want and what you would plan to do with that money. So you had in your packet the narrative section that I guess with your endorsement, I would submit to the Department of Administration probably tomorrow. At the time that I spoke with the staff at DOA, the response to COVID, Cdbg COVID money had been slow. And so thankfully about 3 weeks ago, I said, hey, I'm working through this process. Just want you to know, I think that we're going to spend about $1.7 million of your money. There's 16 million to spend. And they said, okay. And then I had a momentary small heart attack when I talked to them last week, and they said, yeah, the demand for the money's been greater and it's all gone. And I was like, oh. And then they said, but we already earmarked your $1.7 million. So that was good. So our intention with this money is really an expansion of what we're currently doing. We have our community partners with Stepping Stones and WestCap. WestCap established a relationship with 2 local landlords for the current transition houses, and they went back to those landlords to see if they had held up their end of the bargain in the sense of what they had promised that they would do with those houses in terms of the way that they're staffed and they're overseen and whatever. And those landlords said, yeah, yes, you've been good stewards of what you said you would do in the first round. So we have some additional housing that we have available that we would be interested in potentially if you want to expand this transitional housing program. One of those is a 9-bedroom home. And I think it's 9.
Said 9.
Yeah, okay. 9, 7, and then we're looking at trying to create family transition resources as well for because the current system is for single adults, and looking at there are situations in which we have a mother and children, or father and children, or a mother and father and children who are in a homeless situation. So it would be an expansion of 2 or 3 additional transition houses, the case management staff that would go with that. We learned some things the first round, like if you rent the houses, you still have to have furniture to put in the houses, which I don't know how we didn't think about that, but we didn't think about that. So thankfully the public and social media were very responsive and helped us to outfit those first 2 houses, but we didn't think they probably were going to come through for 3 more. So we built in the money for the furnishing of them, for things like Wi-Fi and supplies. A lot of times people are coming with nothing or very little. Food share doesn't pay for things like toilet paper and shampoo and all of those kinds of things. So also some funding to eliminate some of the obstacles that people have to obtaining permanent housing, like reapplying for or getting copies of documentation that they might need, like driver's license, birth certificate, social security cards, those kinds of things that all charge a fee to have them replaced. And then in addition, we were asked if it would be a consideration to ask the Department of Administration on behalf of Stepping Stones for money for them to expand a walk-in cooler on their premises. It's about $76,000 or $78,000. And that was thought to be a reasonable request on the part of the Department of Administration. More money for housing, emergency housing stays. Stepping Stones has worked with the city of Menominee to submit a neighborhood investment grant, which would provide the monies for building of a permanent homeless shelter on the site of the current C3 Center, which is right next door to Stepping Stones. It would be a 20-bed facility. And they'll know in January if they received that money from the neighborhood investment. Otherwise, they are prepared to do a capital campaign to raise the money to build that facility. But in the meantime, there is no homeless sheltering capacity outside of the hotels currently available. And then actually adding a half-time pantry assistant for Stepping Stones as well. So I did speak with, so I work primarily with one of Sarah's staff who does all of the submitting of these claims to the Department of Administration. We have been paid. We've submitted claims and we have been paid. That was a little tedious process to start, but we've gotten it figured out. And so Sarah's staff person was fairly confident that because we were working with the same 2 subcontractors, because they knew what documentation that we needed, it's a matter of us processing the invoices to pay them and then submitting those invoices for claim or payment, that there wasn't it wouldn't be a huge administrative ask to expand this money. And we are able to claim administrative costs. So Sarah's staff person and I both track our costs, our time, and they're submitted as costs to this administrative costs to this grant, as well as other some other administrative costs, but Kathy's time and my time are both directly compensated for from this grant funding. So by the time that we add all of those things up, our request would be just under $1.8 million, which would take us through the next 2 years. So it would be full funding of those projects through the end of 2023. questions about that?
Thanks for your initiative on this. Chairman Bartlett.
At the end of 2023, what do you think's going to happen?
I think one of two things. So I think that West Cap in particular, well, I think it'll split in two directions. Hopefully, with the building of the shelter by stepping stones part of it, they will build into their fundraising for their operating expenses, the ongoing staffing of that shelter. So this provides a really nice bridge for them to be able to, if they have their shelter built by the beginning of 2023, we could flip some of this money towards their staffing instead of the hotel stays and get them kind of in that first year. And then part of their larger term strategic plan around the building of the shelter includes the staffing to that shelter. So I think that need would be addressed in a different way and kind of go away, hopefully. That would be the plan, that would go away. On the West Cap side of it, West Cap is really, I mean, they work hand in hand with the Department of Administration on an ongoing basis, and receive all kinds of different threads of funding through HUD. And so I think either we'll figure out that we have an additional way to continue to do some of this work with funding, ongoing funding through a source that they have to access a lot of their money through a local unit of government, but they could use us we could continue to have a relationship where we pass through some of that money. We've had that in the past. Or I think the other thing about it is that we'll recognize that there are, I don't think that we'll be able to continue to provide transitional housing in the capacity that we are, because the case management is expensive. But I think that we may see that there's a value in that as a resource, and then look to other ways that we could potentially fund some sort of ongoing transitional housing for our community. Not necessarily county funding. I mean, if I've learned anything over the last 2 years, that there's just money sort of that coming from all different places, and maybe that will eventually dry up. But I think everyone recognizes that this is a good opportunity to see whether or not this type of project actually makes a difference or not, and whether or not we're able to transition people into permanent housing. And another 2 years of that would give us a great trial kind of for that. And then it's much easier to make an argument for continued funding if what you're doing is working.
All right. Thank you.
Any other questions for Chris about this CDBG CV grant? Again, thank you for oh yes, I'm sorry, Dr. Hall.
Just want to say how exciting this is. I mean, it just, and last night with that storm and everything, and, is like, in my house, and like, oh no, my lawn furniture blew over, and I'm snug and warm, in a really secure home, and not having to worry about that. And so, I'm just thrilled that perhaps more people in our county won't have to worry about where they're going to sleep at night, and are they going to be warm. So thank you for this. That's awesome.
It's super exciting. And I think what's really exciting to me about it is it does give us that test drive to some different things. It's created some really nice relationships between us and Stepping Stones and West Cap and Stepping Stones. Not that they didn't have a relationship previously, but that's a really nice working relationship. I think it's brought forward sort of the idea that we've learned this with our work with the CJCC too, that if you do some of the groundwork to collect your data, to look at your needs, you're in a nimble spot to be able to react when their funding becomes available, so that housing money, the neighborhood investment money which is also Department of Administration Adventure. Originally, we thought perhaps that we would try to run that money through the county, but there were complications to that with the fact that our CFO is leaving and we've had a changeover on our facilities side. So there were some things. So that was just like, well, why don't you approach the city? And because we had been meeting and we've been talking about these things, and because the city had been a partner in supporting the original application, they were like, yeah, we'll send it, we'll do it for you. So it's just, there's like lots of in lesser tangible things that have come out of this that I think are laying a nice groundwork for the future.
I think the collaboration among the partners has been one of the most significant things about that. And it's not that the organizations hadn't worked together previously, but this is sort of a different level of functioning. And I think all accounts suggest that it's making a difference and will continue to do so.
And if you build a $2 million shelter and you've invested this money into local landlords over the next 2 years, and I mean, there's a definite economic, a number of full-time benefited positions, even if they will sunset, still all of those have an economic impact to our community. It's super exciting.
Yeah. Anything else? All right. Financial report, Chris or Sarah?
That would be Miss Sarah.
That would be Miss Sarah.
Thank you. I'll share my screen so you all can see it. Okay, I hope you all are seeing that now.
I think so.
I can blow it up a little bit. Does that seem acceptable?
Looks good to me.
Okay, I'll just go right to the projected expenses. Our grand total of projected expenses up through, this would be through October, is $12,618,724. I separate that out into operating and salary. Our operating expense is $7,728,432. Our salary is $4,890,292. It foots back to the $12,618,724. So our budgeted revenue projection right now is $9,547,976. We are projecting to use $3,070,748 of county levy. Of the $4.1 million, we are going to return $1,108,168 of county levy dollars back. Are there any questions?
Always clear, very helpful, good news. Any questions for Sarah or for Chris? If not, we will move on. Thank you very much for that.
Thank you.
Thank you very much for that. We have a couple of action items. One is our normal note-to-note receipt of the monthly vouchers. The amount this month is $399,140.35. And in your packet, the staff has done a very nice job of breaking out the staff and the staff assignments and the FTE status of the house calls people who are paid through these vouchers. And I assume everyone had a chance to take a look at this. Yeah? Any questions on that? All right, I need a motion to note review.
Alex, Dr. Hall has that question.
I'm sorry.
I just wanted to say thank you. It's so nice to see, okay, these are the people that all that money for house calls, these are the staff that's funding. And so it's so helpful. Thank you for putting that together. It's really nice. So I will make a motion to note that, yes, we note these expenses.
All right, do we have a motion? Do I have a second? Mr. Lamb, seconds. Any further discussion? All in favor? Aye.
Aye.
Any opposed? note review of the vouchers for October. And then 2 action items. First, both were in your packet. First is a resolution to adopt a community development block grant citizen participation plan, which was also in your packet. Chris, do you want to do any additional background here?
All that I would say is this should look familiar. We did this sometime within the last year in order for the first round of funding. This is specifically related to the planning grant for the housing study. The citizen participation plan that you adopted several months back. It's the same citizen participation plan. It's just that we didn't, at the time that we passed it, the first round, anticipate using it for other types of funding. So this time it will be adopted for any future CDBG use that we might want.
Okay. Any questions? All right, I need I'm sorry, Sarah. I can't hear you. You are muted.
Do we have to update the county clerk?
Oh, and I was going to mention that on both of these resolutions, we need to update the county clerk.
Okay. I just noticed those.
We do.
They both are Julie Wathke.
Yes.
Okay, I just wanted to note that.
Yeah, and thank you, Sarah. I was going to bring that up, but I had the wrong note in my hand. All right, I need a. Did I have a motion? Did I just?
No, I
lose my-
think Jody. Jody, was that your question as well?
And the
Jody had her
same
hand up.
question.
Okay.
Yeah.
All right.
All right.
I'll move I'll move that we adopt it.
All right.
I'll second that.
And Ms. Barker will second. Any further discussion? All in favor? Aye.
Aye.
Any opposed? All right, that is going to be forwarded to the board. And a resolution for submitting the Community Development Block Grant CDBG application. Chris, again, any detail here?
Again, this is specifically related. This is a resolution that's related to the planning grant.
Okay. Supervisor Steen moves. Dr. Hall, do you have a question?
I just have a question on the date.
Can I get a second, please? And then I'll come back to you.
I'll second that.
All right, Ms. Barker seconds. Yes, Dr. Hall.
So my question is the date is January 19th, 2022?
It is because that will be it. This will actually need to go to the county board, and that will be the next county board meeting.
Yeah, both of these are dated January 19th because that's the date of the next board meeting. Any additional questions, comments, discussion? All in favor, say aye.
Aye.
Any opposed? This resolution is approved and moves on to county board on January 19th. Any comments, announcements? I have one. It was suggested before we all were on board this meeting that the Health and Human Services Board offer some kind of memorial to Sarah Kennedy. I think that might be a good idea. The note from Mr. Miller today said that they were interested in donations to the neighbors of Dunn County instead of a floral arrangement. I would be happy to take responsibility for getting that done if members of the Health and Human Services Board, I think that's a worthwhile thing to do and are interested in participating.
Yeah,
I see a thumbs up. All right, I'll go ahead and take care of that tomorrow. Thank you very much for that. I think that's it, unless anybody else has other announcements. Stay safe and healthy, everyone. Merry Christmas.